Hi, this is Alice from the Neem tree. Due to coronavirus, we'll be giving our oral hygiene instruction via video prior to your hygiene appointment. Right, first of all, I want to talk to you about brushing. I think that electric toothbrushes are far superior to manual toothbrushes, so I'm really going to advise that you'll go out and get yourself an electric toothbrush. Brawn Oral-B, okay, this one, or this one, okay? These have all got the same functionality, except for these two higher end models, they've got pressure sensors, okay? So that's gonna stop you causing recession of your gums or over brushing your teeth, okay? So first thing in the morning, okay, before you've had your breakfast, you're gonna get up and brush your teeth, okay? Get your Braun Oral-B electric toothbrush, and you want a pea-sized amount, okay? And pop it right at the very back of your mouth. And you want to spend around 3 to 5 seconds cleaning each surface of each tooth, okay? So you start there and then you're just going to slowly work all around all the front surfaces, the bits you can see when you smile, then right up to the back, okay? Then come round and do the inside by the hard palate, okay? Slowly, 5 seconds, 3 to 5 seconds on each tooth, slowly round, okay? And then all the biting surfaces. Then you want to go downstairs, right to the very back, and super slow at the back, because obviously that's where you do the most of your chewing and your biting and your eating, so that's probably where the most of it is. Slowly round, okay? And then come back on the inside, get your tongue out the way, get right in there, slowly, 1, 2, 3, 4, 5 on each tooth, then the biting surfaces all the way around, okay? Toothbrushing should take a minimum of 2 minutes, okay? If you are anything shorter than that, your teeth just are not clean, okay? If you can aim more for 3 minutes, 4 minutes, this is better, but no scrubbing. I cannot stress that enough. It is a slow, gentle process, okay? Okay, so your interdental cleaning is super important. It's about as important as your brushing. So when you do your brushing, you're cleaning all the outside, the inside and the biting surfaces. That's 3 surfaces of your teeth. But all those surfaces in between, that equates to about 40% of your mouth. So if you're not getting something in between there, bacteria is going to build up. So my 3 favourite things are floss, TP brushes, or rubber picks. I don't mind which ones you use, but you have to be using some. If you're super keen, twice a day. If you're not that keen, once a day, this is good enough, okay? And I will give you a little demonstration of how all of these work. But you should never be forcing anything through. The floss should go through easy. The TP should just pick in there. The little rubber ones, if they don't go all the way through, near enough is good enough. We don't want to be forcing things in between our teeth, creating big unsightly gaps, but we also don't want to be leaving bacteria there, creating tooth decay, gum disease, halitosis, things like that. Right, when picking a toothpaste, you want to stick with a brand name, okay? Nothing random that you found on the internet, nothing that you've made in your kitchen. So Colgate, wonderful market leader. This is Colgate Total, and this contains fluoride, which is going to make your teeth nice and strong, okay? We've got Colgate Sensitive Pro Relief. If you suffer with sensitive teeth, this is a lovely one because it's got fluoride, but it's also got arginine in it, which is a lovely product which just sort of blocks any sensitivity. So you can use that as part of your regular brushing, but then you can pop a little bit on your finger and just rub it into sensitive sites. So if you are struggling with sensitivity, a regular toothpaste isn't going to work for you. You've got to go for something that does what it says on the tin, but again, a brand name, okay? Oral-B, my favourite. Obviously, another toothpaste. Now, this one contains 2 types of fluoride, sodium fluoride and stannous fluoride. So I'm loving the double fluoride on that. And that's just a regular toothpaste as well. If you've got any gum problems, periodontal disease, or you're aware of bleeding gums or something like that, okay, I'm loving the Oral-B Gum and Enamel Repair. This has got some antibacterial agents in it as well as the fluoride. And again, another one for sensitive teeth. This is Sensodyne Rapid, okay? So this is really, really good. Probably not for long-term use, but if you are currently struggling with sensitivity right now and this one isn't working for you, top it up with that one as well. When you've finished all of your brushing, you might want to top it up with a mouthwash, okay? Mouthwashes are lovely because they contain lots of antibacterial and fluoride in them, keep the teeth strong, and it makes your mouth feel really nice and fresh, okay? With mouthwashes, you can pick a brand name, albeit or Colgate, or you can get an own brand one. You just want to flip the bottle over and check that you can find the words fluoride and antibacterial, and preferably low alcohol or alcohol free. And with a mouthwash, it can't just go in and out. You've got to get it in, rinse thoroughly, get it everywhere, shake your head a bit, okay, and then a jolly good spit out, but do not rinse the residue away, okay? You want to leave that fluoride and antibac working its magic on your teeth. If you have a rinse with water afterwards, you've just undone all of the good work that you've done there with the mouthwash. Okay, so these are the super jazzy adjuncts, okay? Once you've done that whole hygiene regime, if you're still feeling keen and motivated and you really want the best for your teeth, for example, if you've had gum disease or you've had a problem with tooth decay, or you just really want to look after your teeth, things you can get, okay, is this lovely water flosser, okay? So this is by Waterpik. That's my favourite brand, but you can get different brands. I don't know enough about them, but I do know that this is a really good brand. So you just fill up the little reservoir with water, just lean over the sink, and then just gently all around the gum line, and it's got a bit of kick to it, so it is messy. You might want to use it like in the shower, in the bath, if you find it's going everywhere. But this will really give you a dentist clean feeling, okay? And it just oxygenates all in between the teeth and gums. It's fantastic if you've got veneers, crowns, bridges, or if you've invested in implants, you want to invest in one of these, okay? Because that's the best clean for around them. If you're suffering with sensitive teeth, you need to put tepid water in there because it will have a zing to it. This is a little gum stimulator, okay? So this is a little rubber tip. You can't do any damage. And with this, it's like you can be your own little miniature hygienist. Just gently take this around the teeth or the gums on the inside, okay? That's not an everyday toy, but if you wanted to use that once or twice a week, then you would have a really nice clean teeth, but gentle, no gouging, okay? Very, very gentle. A timer, we all think we know what 2 minutes looks like, but if you have one of these, it will really let you know if you are spending enough time, and really useful for children. Super simple, okay? And then these little things, disclosing tablets. So you chew them up, okay? Just give them a good old chew, run your tongue around everywhere, okay? Your whole mouth will turn blue, have a really good old rinse with water, and then check in the mirror, see where the plaque is, and then you can go around with your electric toothbrush, your floss, your TPs, your water floss, or your gum stimulator, and you can just get rid of all of the plaque, the superficial soft stuff, and then you've kind of had a little mini hygiene appointment at home.